Once upon a time, doctors and patients lived in perfect harmony. Healthcare costs were naturally kept low by the patient and the doctor being aware of what procedures were being done and what the costs were. If a patient wanted to offer a doctor 2 chickens instead of cash for the services, the patient was free to do so, and the doctor was free to accept or to decline. We call this a free market. Now, this changed in the 1950s and then again in 1965, drastically. And like all good stories, this story has a villain. So this is where you're supposed to say, boo. There you go, you're getting better at this. Now, the villain in our story has imposed himself between the doctor and the patient. Now, this is not a third wheel like when you invite your best friend on a date with your wife. This villain has forced himself between the doctor and the patient with the skill of a heavyweight boxing referee. Our villain is very simply known. We call him the third-party payer. Thank you, thank you. Now, but there still exists today several islands of freedom amongst this ocean of healthcare that's dominated by these third-party payers. And one of these islands is called a healthcare sharing ministry. And when I talk about this, the first question I get is a healthcare what? A healthcare sharing ministry is a nonprofit entity that coordinates the sharing of healthcare expenses without insurance. These are patients, families of patients who are banding together freely to share each other's medical burdens without using insurance. The healthcare sharing ministry helps the patient directly. It does not work with the medical industry at all. The patient and the doctor are free to make their own decisions together, which protects that doctor-patient relationship that Dr. Orient was talking about that is falling away daily. Now, these are not insurance. They're not regulated by insurance companies or by the departments of the insurance of the states, and because of that, they're able to act freely. They're not inundated with additional costs by mandated benefits, by reserve requirements. Because these are nonprofit charities, they are governed by those laws that govern charities, but they are free to operate in a way that is consistent with the desires of their members and not of government bureaucracies. And because of this, they encourage that true doctor-patient relationship, and they encourage the patient to be engaged in the healthcare picture. And see, this is the only way that we will see healthcare costs level out, is if we remove ourselves from this third-party payer-centric system and move back to a patient-centered system. And the only way to have a patient-centered healthcare system is for the patient to know what the costs are. Try to call a hospital or many physicians' office and find out what something will cost. If you can get an answer, you'll get a different one tomorrow, much like if you call the IRS and ask for instructions on how to fill out one of their forms. Now, as Ralph mentioned, ministries are not only exempt from insurance code laws, they're exempt from the individual mandate under the Patients Protection and Affordable Care Act, which for my money is 3 lies for the price of 1. By a sheer act of God, we were able to see in the Senate bill an exemption from the penalty for the individual mandate for these small nonprofit ministries. And so they will be able to continue to operate and accept new members even after the individual mandate. And so there will remain a patient-centered option, at least one, after 2014, assuming that this law does stand in the courts, which I pray dearly that my brother Schlafly is right. Now, the history of religious medical care in our country is long and glorious. I mean, you walk around any city and you'll find hospitals with Christian names: Methodist, Baptist, St. Thomas. that the Christian church began the hospital movement in order to reach out and provide for the poor. But in 1965, the church lost her way. When the Medicare and Medicaid Act was passed, the church and the religious hospital associations should have said, no thank you. We would like to continue doing this our way. And when once they were providers of true and authentic charity, religious hospitals have become little more than purveyors of government bureaucracy. 50% plus of the top line of every single hospital in the country comes from a state or federal budget. Hospitals are now arms of the federal and state governments, not arms of the church trying to reach out with true charity. And see, charity is important. The poor have to be cared for. They will always be here, and they're our responsibility. And I do believe that the rich have a moral obligation to care for the poor, but that the government should neither enforce nor administer that obligation. But see, if the government is not going to provide that charity, which I don't believe that they should, and I think you agree with me, someone else has to. And I think that we have lost our way and we've forgotten that as a society, it is our responsibility to freely give of our own funds. And I do not believe that government charity will go away until we start competing with them at their game. And so one of the projects of Samaritan Ministries, which is the healthcare sharing ministry that I work for, that we have just begun, is to start a truly charitable full-service maternity hospital in every major city in the country over the next 3 decades. We would like to have the first pilot hospital up and running by January of 2013, which I know is an ambitious and possibly impossible timeline. But these hospitals will receive no federal dollars, no state dollars. They won't bill Medicaid. They won't deal with insurance companies. They will treat the poor patients who are pregnant and needy free of charge, because the desire on our part is for Jesus Christ to get the glory for that service, not the government. And I thought that line might be safe in the buckle of the Bible Belt. But in order to do that, it means that we need to give up our own personal freedoms to a point. But see, it's not giving up freedoms, but privileges. If I choose not to go out to eat tonight so that I can give my money to someone else, that's not a restriction on my freedom. It's a gift. And see, that's what charity used to be. Doctors used to look patients in the eye and give them medical care knowing that they were needy, because you cannot provide charity through a bureaucracy. True charity has to be face-to-face. It has to be personal. There's only one way to know if a person is truly needy, and that's when you have to look across and see them in the eye, and they have to lay down their own pride and accept that help. And we've dehumanized charity by allowing the government to administer it. And I say it's time to take it back. It's time for the Church of Jesus Christ to act again the way we acted when the hospital movement was first begun. I was at an event 4 years ago during the height of the S-chip expansion fight under the Bush administration. And a speaker got up from the Catholic Hospital Association, and I was excited because I thought, here we're going to hear some sanity. And the line that he gave that still rings in my ears was, in defense of S-chip, he said, how is it possible that we cannot agree on free health care for poor children? And my question to him when I saw him in the hallway afterward is, what is stopping your hospital from giving away free health care to the poor children right now? Why does Congress have to pay you to do that if it's charity? He did not want to talk to me any further. But see, this is where we begin and end, is that charity belongs to us. And so healthcare sharing ministries want to reach out and to give. And we want to continue to protect those liberties. But charity happens personally out of our pockets, out of our giving. And if the government charities are to go away, we have to act ourselves in competition with them and take it back.